If you or someone you know is sick, have tried to get help and is not feeling any better, then call or visit the Health and Wellness Center, where we will screen your entire body and find your problem and treat you so that your body will overcome your illness. So visit us today, 72 Queen Street, Kitty, or call us at 231-6477 for further information.
Always looking out for us on our program on Thursdays. Welcome once again. So, your very special health program that's been around for seems like decades, since 1996. With me today again is Dr. Richard. Dr. Richard, welcome.
Thank you.
All across the ocean in Atlanta, Georgia.
Thanks for the invite. Thank you for the invite. It's cold.
It's cold out there.
Yeah.
Oh man, it's very hot and sunny here. We have a little rain. It's nice. It's not very hot. It's not cold. In the mornings are cool. We get some rain to kind of set the stage for the day, and that's it. We're in the 70s or 80s, and that's it all day.
That's nice.
You got to experience it, Dr. Richard.
Yeah.
Nice.
They won the cashews in season.
It's in. They're in season. That's right.
Oh wow!
Right where the house is, across the street, there's a big tree, and it's full of cashews.
Hey, collect some for me.
Some people call it Malacca.
Malacca. Oh, that's the
Malacca. Yeah. They have different. I guess it depends on which country you're in. What part of the world they have a different name for it, but we know it to be cashews. As a matter of fact, there are two types. That's one type where the fruit is red and the seed is on the inside. There's another type. The fruit is also red or green and the nut is on the outside.
Oh, that's a cashew.
That's the one that we pay a lot of money for.
Yeah. That's the one that did a job on me when I ate it.
We ate it the wrong way.
Yeah, burn up my whole mouth.
Without process. Yeah, it will do that. It will do that.
Yeah, a little knowledge could be dangerous. I know.
Even though you have to get the nut from outside of a shell.
No.
A protective.
Yeah.
You know, cashew, they're right near the house on the highway, right?
Mm.
And anyone can pick them. One decided to pick some of them, and I knew they had to be processed because you can't see the nut. Nut is your tin of cashew nuts. You can see the nice shape, the nice color.
Right.
So I picked some of them, and I decided to experiment with them. I actually put them in the oven and baked them.
Oh wow!
Yeah, man, if you see the oil that came out of that thing.
Wow, really?
There's a lot of oil. I think it's useful, but you have to have, I guess, the machinery to cashew oil. I think there is, but the oil itself is very, very strong and pungent.
Toxic.
So I can imagine when you eat that, what happened to you?
Burn. I mean, you can do probably.
Burn up.
Yeah. In that thing,
Yeah, but when I opened the nut, cashews you buy.
Really?
Yeah. Yes, I did.
Did it taste the same?
Yes, it did.
Good. Unprocessed.
Same thing. But I guess if you have a cashew nut factory, you have to have everything that probably produces.
Thing is, I wonder. I mean, like one fruit has nut on top, right?
Yeah.
It only has one nut, not a whole lot.
One nut, one fruit, one nut.
So they a whole lot of fruits then, right? Get them nuts.
I don't think they're destroyed because the
They eat the
fruit
fruit. I mean,
itself, the fruit itself can be eaten.
right?
The fruit is edible, so I don't think they throw that away. They make juice sweet.
Right.
I know they don't throw that away. They don't. So
I never really wanted to eat because it has like a, I don't know.
it has a type of taste at the end.
Yeah, that, and then it. I don't want to offend. It tastes like like we a old a old, you keep some old books or something. That's a. I mean, it's the taste. It smells. I get the smell. The smell is like that, but
Maybe it's maybe it depends on the time of the processing of that fruit. Maybe when you pick it, it's not ripe. It's not ready.
probably
Because when it's ready, it smells nice.
because
But when it's not ready, it doesn't have that pleasant odor. I understand
yeah,
that.
yeah. I feel like my tongue is yeah, it's like that sort of taste. But I like the one you can buy. You see that nice. Oh,
that one I'm talking about, they use that to make for Christmas cake too.
oh, really?
Yeah. Yeah. It makes a very nice.
Uh-huh.
And when it's ripe, it gets kind of purple in color when it's really ripe, and it's so.
Mm-hmm.
When you eat that thing, man, you can eat that thing. You can eat that for lunch or dinner.
Wow.
Yeah, but if you eat too much of them, you can get sick. No, you get sick because they're so juicy and so sweet and they're filling. And the more you eat, the more. But it's in season, and you're welcome to come, and I can take you to the tree, and you can get some. I don't have a tree myself, but my neighbor does.
Oh, then it's probably dropping all the.
Oh yeah.
Like nobody. I mean, you eat a few of them, you get tired. Just like the jamun.
Dr. Richard, you need to come to Guyana, man.
Yeah. I need to.
Guess what? I mean.
Whoa.
And I had a friend that brought me an entire box of mangoes.
What?
Box of mangoes.
I could envision the taste.
Sweet.
Wow.
The mango is very sweet. I'm telling you. When he brought it, he said so. He said, Doc, I'll put some.
Wow.
He's right.
Is
it very
sweet?
Mango? And then this weekend we're going to a friend's place that has about 20 mango trees or more in the yard.
Oh my, yeah, wow.
And they have the turpentine mango.
Nice.
Yeah, and it's ready. Christmas in another couple of weeks.
No, I mean just going. If I go right there, it's Christmas today.
So Guyana has its.
Yeah.
And there are only a few things about I don't really like at the moment, which I hope that they work on. They're working on some of it, but they need to work on the roads a little better.
Mm-hmm.
And on the noise nuisance, people playing loud music, and they have these motorcycles that the guys take off.
Oh wow.
For those tons.
They take off the muffler.
They take out the exhaust and
wow.
Yeah.
I remember that as No, that used to be be the for a while the thing to do and make you sound like
Like you, right?
you're really in charge of the.
Yeah.
You can hear the
Yeah.
sound before you can see the person coming.
You hear the sound before you see the bike.
Yeah, yeah. It's
Yeah. Um, we have a program today, and I know we talk about all sorts of things, but the people are looking for maybe some advice. This is the pepper pot season coming up, right?
Oh wow, yes,
Pepper pot cake and garlic pork and
oh
and sponge cake and mauby and sorrel, you know, salt. I mean, all the things that are not made normally all year long, made between now and January, maybe January 3rd or 4th. So we know that there are many persons who had a this one is in his 30s. And he was telling me today about a place that they call the Palms here. He said he went there to the Palms to visit someone, and he wouldn't believe it. I said, when I'm thinking the Palms, we know that it goes there, right? They go there for their therapy and their treatments and so on.
Mm-hmm.
And if you have leprosy, you go to the Palms, that kind of things. So he said to me, I'm listening to him and I'm thinking that this is a place for the elderly, and a story about the elderly people there.
Okay.
But he said, Doc, I used to think that it's a place for the elderly people.
Mm.
He said, but when I went there, and, and they can't walk, arthritis, and he said these conditions. And he said, I found it so difficult to believe because here I am in my 30s, and these people are in the 20s.
Wow.
And they're suffering with all of these conditions. He said, what's happening? But we know why. We know why it's happening.
Yeah.
Okay, we talk about this before. We talk about it all the time.
And we see it all the time.
We see it all the time.
See people. And speaking about that, I had an email. You just brought that to mind. And about
Oh yeah.
the Adventist, very well known pastor, speaker. He's usually I think he works in Congress, right? As the one of the, I think it's the minister, pastor of the
he's very prominent.
The Senate right now, the Senate, and yeah, he had told me that he had and they had to be rushed to the hospital. And they had to do emergency surgery and so forth.
You're kidding?
I'm not. I wish I was. I read it a few hours ago. So right now he's in the hospital, recovering from the surgery. They did the surgery and it was successful. But with things, exactly what's going on. I didn't have a chance to fact check it. This is somebody that's very friendly. Wow.
My goodness. I know Barry.
Yeah. And he just spoke, was at Oakwood University College on this last Sabbath.
He's okay. He's all right. He's going to be okay.
We don't know yet. So we're just out there asking for prayers. No, he's a chaplain for the Senate.
Right. He's one of the
One of the chaplains of the Senate.
Larry.
Mm-hmm. So
yeah, when I was at Oakwood, he was there.
Yeah. So, we ask for prayer. We need to keep him in prayer in the family. And the thing about it, that he spoke this past University Church. He mentioned that he had sent his wife away. She gone, I think, on a cruise or something like that to Australia or somewhere on the weekend. I think he took her to the airport Thursday or Friday or something like that. Keep that family in prayer. But when aneurysms, stroke, CVA,
I want you to expound on aneurysm, because a lot of people don't know what is an aneurysm. But I'd like you to talk about that and what can contribute to the aneurysm, because that is something that happened to someone or to some. They had aneurysms, and these guys were in their 20s. So we were looking to see what may have contributed to that. One thing that I thought of that I know they do is that they used Red Bull and Guinness.
Yeah.
They drink Red Bull and Guinness mixed together.
Mm-hmm.
Drink Guinness stout together.
Yeah, caffeine and alcohol.
It's a bomb. Just explode in your brain,
Yeah.
Or in your arteries, in your blood vessels.
Right. So the aneurysm really you have blood arteries going to your head and your neck and in your brain. There are arteries. It really is. It's the arteries is like think of an artery as like a hose, right?
Yep.
And it just gets blood there, but in the brain and in the neck, like the carotid arteries and so forth, those arteries, it's not fully, the integrity of it is not fully consistent. The elasticity is lost, and the collagen is lost. Like used to take out the tires, the tubes from the tires and fill it up with water. The bulk of the artery.
Right.
And
right.
when we fill the tire, sometimes remember we used to have animal water. What happened?
That's a good explanation. A good breakdown. Yeah.
So there's bleeding, once that artery is popped, or broken, there's bleeding. And
your brain could be filled with blood in a minute.
Right. And once that happens, you're not getting blood to your brain, and brain is just bleeding out. I get nutrition, oxygen
because it's saturated now with blood.
Right. So, with him, I'm hoping that they're able to go in.
And you have how much? The time lapse.
Time.
Yeah.
Because person is having a brain bleed or something, then they're not getting oxygen. The blood.
But when I just remembered. I was reading an article at some point when I was looking at aneurysms and heart attack and stroke. And one doctor, who was a radical doctor, he experienced an aneurysm or a heart attack. You puncture some part of your body and allow the blood to flow out. But when you do that to some facility, that's not all the details. I don't want people to start doing that, but
no.
But it was a science that he used that indicated that when you have that compression, it happens. If you feel it coming on, you puncture and allow the blood to flow.
Well,
To relieve the pressure.
I mean, there's some the mechanism that he's talking about is really what he's trying to do is to release the blood from going to the brain.
Bloodletting.
Right, and it's going. That once the blood starts pouring out in the brain, it starts to release the matter, the brain tissue, and that can cause you to have severe damage. Increase the pressure in the head.
You're now contracting. You're narrowing the space.
Right.
Right. Around the brain.
Right, increasing the pressure in the cranial pressure, and that can cause damage to.
And you can die.
I mean, the mechanism. What he's saying is just deviate the blood instead of having it go. You're trying to let it out.
Yeah, have it escape
somewhere. Increase the pressure. Too.
Something
like that too. Yeah. But so.
But that is something that it's so important to expound on or to understand, because sometimes person who go to they broke a tree in their sleep, or they suffer a cardiac arrest in their sleep. And I studied that, and something happened that made me understand what may cause that. I am of the opinion, this is my opinion, that many persons die in their sleep as a result of a dream. A dream. Yeah. Because if you suffer with a condition and you're dreaming that someone is chasing you, and person, you're actually going to experience a condition that makes your heart goes faster, because it is happening to you psychologically, internally. It is not that process in a dream. And if you're not able to handle the pressure of that one, it could be other things. If your body is at a point where it cannot handle the force that causes that, it's going to get hurt. Persons, and it happens to be sometimes, when you wake up out of a dream, your heart is racing, or you feel body is shaking, depending on the type of dream you had. But many times when a person dies in their sleep, they just don't die in their sleep. Something caused that death in their sleep. And I believe it's a dream.
Well,
babies, crib death, right? I studied the crib death situation a long time ago. And in my mind, I try to analyze all the time. And then this baby dies. Could have caused that if this is a healthy baby. This is a healthy baby. And what is that many persons feed their babies before they sleep. When a baby is fed, sometimes they burp and they vomit. Right? It happens most of the time because of air or whatever it is that causes them to vomit. This is when you're alert. You would catch it as a parent or someone who looks after that baby. But the baby is lying on its back, and that baby is fed, and that happens in their sleep. Who is there to take care of that, and where does it go? So that baby probably drowns in its sleep from its own.
It's happened before.
On that, I believe that it's caused from that factor. Feed heavily during the night, not when they're going to sleep. Don't feed them like,
when you have to make sure they bubble, at least, and then keep them.
Make sure that they burp.
Yeah, they burp.
We say burp, and that air,
right.
you would get the baby and you would clean it up and so on.
Yeah. I mean, they changed right now, but they were saying at the time that you shouldn't put the baby on the back. You put it on the stomach, after you feed him.
Right, because on the stomach, if the baby burps and it comes out of the mouth, and they're on the stomach, it would come out.
Yeah, but that changed, and I guess it varies. A lot of the babies, the infants especially, laying this, either what they're laying on would block the passage for the air out, maybe, and then they're able to breathe.
If it's some pillow or something like that.
Yeah, so it's like more like sleep.
Yeah, they suffocate.
Destructive, right? So I mean, it varied because it changed. When we had our kids, never put the baby on the back after you feed them. Put the face down. Organization. Then it changed after they found some cases. So we'll never put the baby back, So I don't know. I think now they're telling them to put them on their backs when they feed them because they have overwhelming evidence that crib that was of obstruction,
There is obstruction in my opinion, but the obstruction can't be in my opinion.
A lot of times they can do when an autopsy, they can tell what's what.
That's
right. That's just
that tells a story. Situation with all this pepper pot and what do we? It's hard. I mean, as I'm screening persons all week who are diabetic and hypertensive, we talk about it and we go through their dietary restrictions. I'm going to handle all this pepper pot and week and all that.
Yeah.
So
that's a problem. I mean, a lot of people wish that they didn't come now. They get screened.
Some persons are avoiding coming because of that.
Yeah.
One person, I actually because you're going to put me in a restrictive diet. I said, I'm not going to put you in a diet. It's your body going to tell you.
Yeah.
But you're going to restrict me from eating all sorts of things that I want to eat. And, I got my I can't do without that. All these things I can't do. So when we go through the screening and we have to look at their dietary restrictions based on, remember, it's what you shouldn't use, right? In this sorrel, gotta avoid sorrel. They may have kidney stones or over acidity. It's a sorrel. So it's a sorrel. Sorrel. This is Christmas, You telling me I gotta avoid sorrel?
Yeah.
So I would say, look, you know what? But for the sake of Christmas and your health, be moderate. Be just drink. Nothing wrong with you. If you have a restriction, take a little bit and be okay.
That's nice. Still nice, but some people in this it's Christmas. I can yeah.
But if you do the wrong things now, you may not see the next one.
It's true.
So better you make the sacrifice now to see more.
Yeah, I mean, I'm finding that the key, and I know that's what it is your diet. I mean, I don't care what. I don't care what. I'm
Yes.
thinking like I'm looking at the person. He is very health conscious. He even talked about he was fasting for a little bit, and he even runs every day. Expect a person,
So not aneurysm.
right? But sometimes it has to do, especially the aneurysm. Sometimes we're born with certain defective, Some people are born with berry aneurysms, and some of them clustered, and they're genetically, predispositions for those, and they may not even know that they have a problem, until come to, so you don't know. We don't know the state of our bodies, We have to just do our best, It's like, and I always make reference to expensive vehicles, because we like to see things and understand practical things. You have an expensive vehicle that may look nice in the inside and the outside. Very, very beautiful. Chinese guy is. I met him, and he had a Rolls Royce. Okay, he was given a Rolls Royce by his daughter. She did well, and she wanted to him. So apparently he was looking at Rolls Royce. So because she did well, she was able to make a lot of. He liked, and he bought him a Rolls Royce. But this Rolls Royce, you can always tell, it was shiny. Everything that could shine is shown.
Is that the one you sent me the other day?
No, not that. That's the modern, modern. That's the modern version of it. That one is self-driving. Yeah. All you do is just go inside and sit down. And that's it.
I didn't really.
There's no steering wheel. There was no steering wheel.
So you just sit on the road, takes you where you want to go.
It takes you. You chart it. I don't know the details.
I guess.
Probably, yeah. And then you just start sitting there and go. But here's this guy. I mean, this Guyanese fellow, nice man. That car, he spent time. It looked mint, like it came out from the factory today. But you can have. We can do everything in our powers, but then we don't know the mechanical aspect of what's going on inside of us.
Mm-hmm.
People, and they do helpful things, but yet they still succumb to. And the guy who did, as a matter of fact, he was the runner, and he wrote a book, running.
What?
Exactly. Oh, you want to wait a minute? Wait a minute. This guy looks healthy.
Okay.
Oh, you did? Oh, okay, yeah. He looks healthy. I mean, everybody wants to be like.
Yeah.
Had that. No. And he died from running. So it's like, well, in the world. So, we can only do our best. And many times it's happening to us. We see things happening. We're the ones.
We are aware. We are aware of the changes that occur, but sometimes we overlook them.
Yeah, overlook things.
Women hardly overlook those things, but men do.
Yeah.
And that is why the woman outlives the man. Because if her head hurts, she gone to the doctor.
Yeah.
Oh, it's just a headache.
Yeah. How long you been here? Every so now and then, not too long, you know.
Yeah.
How many years? As long as I know myself, it doesn't happen. So,
It only lasts for half an hour. And
the macho man.
yeah,
But I notice we do have a lot of women patients than do men.
that's the reason. Because men, and I really trash men sometimes on that issue, because
Yeah.
men act as though they're macho. They're sick, and they know they're sick. They have problems with urination, and it's not because it happened to me. If I
Yeah.
happen to eat something that I like that's sweet, I'm going to pay for it when I lay down to sleep.
Yeah.
But if I don't, I'm fine, right?
Yeah. Yeah.
Who don't have, because they have to urinate all night.
Yeah. Yeah.
And they say, well, you know what? I mean, it's been happening to me for 5 years, so I'm not accustomed to it.
Yeah.
You know? Prostate issues.
Mm-hmm.
They have urinary bladder issues. They have issues with their kidneys. They have these issues because they don't have themselves screened properly.
Right.
You know?
True.
They go to get made. They may go get a PSA test,
Mm-hmm.
and they may come back a little elevated, and they may be told, well, you know what? You take these. That prostate did not enlarge because of the prostate. Something caused it. And that is where you need to take responsibility of the root cause of things.
Yeah.
They don't do that.
True.
You know, when you come to us, I think we people who what we do, because we take time to scrutinize and to dig and find what really is happening at the bottom before we administer.
Yeah.
We do that, and this is where I think we differ from many, because we take long with the patient or with the person. But why are we taking long? It's not because we like to be there with them. It's because we have to find out what's causing them to have what's wrong with them.
Right. And then we have to go through. We have.
Because not because you have a headache, it means that you have a problem with your head.
Right.
You know, most persons who have issues with their bodies believe that that is where the issue is, and that is the problem that we have with many situations where a headache. Yeah, but your headache is not just your head. Like, many persons are having problems with their vision, with their eyes, and they think that the problem is in their eyes when the problem is in their brain.
Or, you have
or in their
diabetes.
kidney or in their liver. It's you know, so it is not. It is have to screen you in totality to ensure that all of the organs are in synchronize or in sync in with the other.
Mm-hmm.
One is not in sync. That's the one that's causing your issues, giving you a headache. Have the right frequency. Mm-hmm. Not one that's out of line. That one organ that has a problem, an issue. The reason why you're having a headache could be the reason why you're urinating frequently. You know, many persons who are urinating frequently believe that it's.
No, I mean, it could be. I mean, I'm finding that people, a lot of people who have a problem, they think, and sometimes it could be an infection. Sometimes it could be, you're having some prostate problems, prostatitis, or a lot of times it could be because you have diabetes. And you say, well, I went and got tested for diabetes, and they say my blood sugar is okay, it's normal.
Yeah.
But then when you come and get checked, the blood sugar. Yeah.
It happened today. Mm-hmm. And the guy was urinating in the clinic here frequently. He said, but doc, my blood sugar is, and I said, did you have my blood sugar? They say it's normal. Why you need? Well, I don't know. I think my prostate is a little. When I screened him, his blood sugar was totally elevated.
Yeah.
Totally elevated. He had no clue.
It's an independent diabetes, and you know
He
the
had
other
no clue.
markers. And you know when you look like the glucose goes and it attaches itself to everything, goes and attaches itself to, and then you have problems with your fingers and toes.
And the symptoms are all there.
They're all there. So anytime glucose goes, when the glucose is high, it goes and attaches itself to every system in your body. That's the reason why you're having hypertension. Glucose goes there. You have some free radical situations occurring. You know, you can have arteriosclerosis. You can have anything.
I'm missing
Yeah.
arteriosclerosis of it. I had a patient yesterday who's having problems with her vision. She's like, I have to come so close to see, recognize anything. She says, well, yeah. But they told me that I have cataract, but I have surgery, and I to do that. So I'm saying, well, let's take on, because to me, greater than just what you're saying. It seems great. There, and Oliver's reminded me, thanks Oliver, that one of that he had heavy metals in her brain. And then the other one that compounded that was that she had plaque buildup in her arteries of her brain.
That'll do the number. That'll do the job, and then she can the cerebral vascular action.
Exactly, because it was so, I was shocked. I was really shocked. And then lead and cadmium.
Yeah.
Loaded in the brain.
Number.
And then I'm being reminded that she also had sleep. Finding so many persons with so much heavy.
That's toxicity levels, lead and mercury and all those. They can't tell you, I know years ago, I mean, especially for lead and things like that, you can say, well, it's the gasoline, right? Because there used to be leaded gas, right?
Right.
I don't know if that still exists in Guyana. I mean, really? And it does the number on the environment.
Still exists.
If you live in a busy main road, and all that fumes, along with carbon, a lot of carbon dioxide, slipping here and there, a little bit at a time. The environment contributes to it. But I'm seeing a lot of those levels in people in the interior. I became master at it now. When I see certain levels, I can tell exactly where. I can tell them, and they're amazed. I say, "You're in the interior." It's like, how you know that? Because the levels, and they're doing a lot of mining. People are drinking the very same water that they release.
They're getting from the same source.
Yeah. So
same source, and then everything is fried.
Not true.
Everything is fried. Who's they're mining. And when I looked at him, we screened him, he's he's getting numbness here, you can't sleep, all sorts of things. When I screened him, he was so congested, plaque. So he says, what is all cholesterol high, triglycerides high, system, arteriosclerosis? What's going on? I mean, where are you getting all this fat? He said, Doc, it's fried. And guess what? They reuse the same oils.
Ooh.
The same oil over and over. The same oil they used to fry fish, they used to fry plantains. They use it to cook with and all of that. And it's crazy. Dr. Richard, I'm telling you, why we are seeing so many sick people is because they're digging the graves with the teeth and eating themselves into their graves.
Using that oil, I mean, the oil is full of free radicals, and free radicals does a lot of damage. You know, it does a damage.
And then the farmers are spraying the plant with the chemicals to make them ripen quicker, you know, to kill the weeds and to kill the bugs that are there in the plants. And guess what? When we buy it, we can't wash it out.
Yeah, that's true.
It's in it. And then we have to eat it.
So I can hear somebody says, man, they're killing Christmas.
We're not trying to, what we're doing is trying to sensitize people. Grow your own foods. Grow your own. Even if it's in the tires, grow your own foods, because when you grow it, you're not going to put chemicals on it to kill yourself.
Yeah.
You know, people need, I think what people need education. They need to be sensitized to contributing to the health issues. It's not happening. And we
educate. And I tell patients, the ones that got better, I said, now you know, man, you need to go and share the information and educate people about what it is that you learned, and show them, teach them, you know, because you can't do it. Not everybody's going to come and get us.
I had a patient yesterday who I saw her for the second time, you know, with follow-up. And she revealed to me that she came the first time, her family members told her, don't bother with that place. Don't take them things, you know, hospital and get this. And in home, she's saying to herself, I already gone there. I went. She didn't tell them that. She told me that. You know, I already went. Find my problems. Now with me, I'm going to follow it. In her mind, she said that. And she listened to them, and she followed, because she was sick and tired. And she followed it. I told her, I says, all I want you to do for at least 1 month, just follow it. Just for 1 month, just do it. You know, I sensed the doubt in her because she did it. I didn't really recognize her. She looked so good. She smiled. She wasn't dragging herself. Someone didn't have to bring her anymore. She came on her own. And I looked at her and I says, well, tell me now, how do you feel? She didn't listen to those people that think I'm dead.
Yeah.
Because they didn't know I already went. You're telling me to go. Today, I can clean in my house. I can use my severe. I says, we're doing it. And now it's going to be like a disciple, you know, going on there. Don't listen to them. If they can't help you, tell them to leave.
They'll tell you exactly what's wrong.
Yeah, imagine learning.
Yeah, the doctor told me to come here. You know, and when I finished with her, she said, I'm glad I came. I saw exactly what's wrong. You know, and that's the thing people don't realize, is that we will show you everything that is wrong. You've seen it, everything exactly as we've seen it.
You know what I started to do on this trip? Speak with the persons who were treated and so on. I said, you know what? You have a testimony, but we're going to start recording it and let the world hear it. They says, yeah, I'm glad to do it. People are now willing to give their testimonies because they're seeing what we're doing and they understand what we're doing. Come when they understand what they need to, why they need to restrict me. I do. It's not me really telling you what not to eat. If you eat, your body is not tolerating it. That is the reason why you're vomiting, because your body is rejecting it. You know, so it's not them saying that you need to do it. It's your body telling you not to do it because your body has the mechanisms to heal itself. It does. We can't heal anyone.
No,
we can only put you in the path of healing, but the body has to heal itself. I say it all the time. If anyone tells you that they can heal you,
the Lord, He's in charge of you. We can only tell you what you know, how you have been assaulting your body. We can show you how to, and God does. It makes a difference. I mean, I've had people who said that they've been everywhere and they were praying. They wake up this morning, or they wake up a few mornings, and the Lord impressed them to come, and there's a reason why they come. And they're not sorry when they finish them. They're not sorry, and they're willing to do everything that we recommend for them to do because they're tired of being sick. Yeah. And when that happens, I mean, there's great transformation and great changes. Okay.
And those are the ones who are able to be healed.
Yeah.
Because they come with the conviction.
Yeah.
And they would have tried anything else and it didn't work.
And
they decided that, you know what? The last place.
This is it. And some do say that this is it. To the States, there, every place give me this medication, that medication, and I don't want to take any medication. None. And they're glad they came. But the thing is, people have to make a decision for themselves. I mean, I'm a medical doctor, do all the training, but then it baffles me at times when I'm seeing patients who've gone for different treatment, month, year after year, getting the same treatment, and they're not getting any better. Yeah. And I'm saying, what is with this? I tell patients that I see now, when you get better, leave. This is not what we're here for. We don't want you to be coming over. We want you to be restored and to be able to healed of the problem, not to come in over and over again. And patients will do everything we tell them to do. Good.
Yeah.
They are good.
That's the miracle that happened.
Yeah. And they're passionate.
That's the miracle.
They're very passionate. So I got an auntie that has this problem. I got a cousin that has this problem. They have to know. They have to know. As a matter of fact, they ask me, where did I went to? And I'm telling them, I'm bringing this one, and they do, and they bring them. So, all honor and glory goes to God, not us, but, what we're doing is very, very important. Very, very important. And next year,
to those who understand and follow.
Even the skeptic, skeptics, after a while, they'll tell you, I was told not to come here. I didn't want to come here. But I came, and I'm glad I did. But next year, I'm saying next year, the new administration in this country is taking a preventive mode, for chronic illnesses.
Mm-hmm.
And you've been on this pathway for how many years now?
Oh man, I was on this path since 1993.
No, the American government is going on this path. So people now are seeking and I come to realizations that I'm taking all this medication now year after year, all this metformin this and metformin that, thing for diabetes, and I'm not getting any better. My dad did this, and he died from diabetes. You know, and I want a difference. I want a change.
It's
And that's what
coming.
we were asking for. And this is where we are right now in this country.
Yeah, it's
going in that
coming.
direction. You know.
It's don't like it, but it's coming.
Well, yeah. I mean, listen. The people who don't like it, if they were the ones that are experiencing the illnesses, I'm pretty sure they would want to have a solution to their problem. The proper solution to their illnesses. Everyone, anybody with the common sense would want that. You don't want to be getting medication every day for something that you're not getting any better. Usually you get worse. And I body and I can, the medicine that I was trained in. I mean, there's a place for everything. Emergency situation, you're bleeding, you're having some trouble. You need to go to the emergency room. You need to, you need to get
find the bleeding and stop it.
Stop.
And then we'll find the reason why you're bleeding.
Yeah.
Unless there's an accident, which is
an
clear.
Accident or trauma, you need surgery. Doctors are needed. The medical profession is needed. Everybody's needed. Everybody's needed.
I think what needs to happen. You have a couple of minutes more. I think what needs to happen now, which is beginning to happen there, is that the world needs to take a more preventative prevention.
Mm-hmm.
Let us deal with what is causing the issues.
Mm-hmm.
Fix that.
Yeah.
And then you wouldn't have the issue anymore. It's like your vehicle.
Mm-hmm.
If you're running and it's missing, or it's not, you don't have the power that it needs to be gotten when you go on the accelerator. What are you going to do? You're not going to park. If you want to keep driving it, you have to go fix it. You take it to the mechanic. The mechanic puts it on a device. He finds where the problem originates. He fixes that. The only difference is that he can change parts.
Well,
he fixes that, and there you go.
What we do with this technology, we can restore parts.
We restore parts. Exactly.
We can restore you.
It's so beautiful, so unique, and I see it all the time.
Yeah.
Restores the body system.
Yeah.
Restores the organs. Restores the cells.
We're not giving you. We give you. Thing that God created you with. We can just just restore it. And
I hate to interrupt you now because the time is up, and we need to continue this some more. Dialogue is I think is rich, and even though we didn't any particular area too much, there was a lot that was said, and I know people will tell us that there was a lot that was said, and there was a lot that was learned, and we're not going to interfere with the Christmas dinner,
No.
All I'm going to say is be modest with what you do.
Yeah.
Be aware that you have a condition that exists, and that you don't want to overdo it to create a bigger problem. So be moderate, and when you finish, remember that you have to detoxify, deworm, and get back on your regimen.
Yeah. Then be temperate in all things.
Be temperate in all things.
And leave Ram goat alone.
Leave Ram goat alone.
Yeah.
So I think we'll have one more program before Christmas Day.
Or next Thursday?
Next Thursday. We may have a program next Thursday, I think. Next Thursday is going to be the 19th.
Oh, okay.
Yeah.
So that's probably more going to be inclined with your Christmas dinner, right?
Yeah. Spend more time talking about this dinner and what to try to avoid and eat a little. So on that Christmas dinner situation, I think a whole lot more people are going to probably want to listen to that because you're going to want to know what I should not eat and what I should eat, how much of this I should take, and all of that. So,
That's nice.
all right. So, on behalf of the Health and Wellness Center, George and Linda, Guyana, we want to thank you for listening in on our program and for watching and for tuning in. And Dr. Richard, as usual, thank you very much for valuable. I used to really have to dig to do a lot of things, but with your brain, it makes me feel a little more relaxed because it takes some pressure off from me. So thanks for being on the program, and I know you enjoy what you do now, because and the people are they're very grateful for your involvement. And Diana, I wish she was here to be able to be with us, but she has to be battling with bullets and guns and smoke and fire in Ukraine.
Very soon it's going to end, though.
I believe that.
Very, very soon. Maybe
I believe that.
Next year, in January, after January 20th, Friday on the same day. I'm thinking.
I really hope so. I'm looking forward to that. So thank you very much for your participation. And the guys in the studio want to thank you for putting up with us and for giving us the little input that you give us, Oliver and the staff, all who contribute to our programs, and the patients out there, the people who believe in us, that are willing to follow the path of recovery. Because that's what I see it as. When you come here and you're sick and you're tired of being sick, when you get that recipe or that directive, just follow the path and you're going to recover. It made a little sacrifice, but it's going to be worth it. So thank you very much, Dr. Richard.
Thanks for the invite.
You have a wonderful evening, and till we see each other again, God bless you.
God bless
and
you
your family.
Thanks.
And good night. So long.
So long.